Hi, okay, there we go. Okay, yeah, so sorry, we're having some issues with sorry, we were having some issues with the, yeah, so we're live. Okay, so sorry about that. We were having some issues with our camera over here, so, okay. So aloha, I just want to thank you for joining me today. My name is Dr. Kathryn Taketa-Wong. I'm a naturopathic physician and acupuncturist. And for those who aren't familiar with naturopathic physicians, we're trained as primary care physicians. And as such, I can order lab tests, write prescriptions, and do school physicals, just like other doctors. However, a big difference is that naturopathic doctors are trained in using diet, vitamins, herbs, and other types of natural medicines to address the underlying causes of disease and treat the whole person. I also have a master's degree in Oriental medicine, which allows me to include Chinese medicine and acupuncture in my treatment protocols. So today I'll be talking about special needs, and I'll be talking a little bit in general about special needs as part of our special needs awareness campaign for these next couple weeks. And so we'll be starting that, and then later on, in a few minutes, I'll be bringing on my mother. I'm very honored to have her here today and to be talking to us about her experience and sharing her experience as the mother of a son with special needs and just any thoughts that she had to share. So, so just to kind of start out, I just would like to kind of give a general overview in terms of special needs. So the term special needs refers to when there are special accommodations or needs that are needed in an educational or other setting in regards to help address needs for physical, emotional, behavioral, or other types of disabilities. And so this term includes conditions such as autism, Down syndrome, cerebral palsy. It also includes learning disabilities, sensory processing disorder, epilepsy, and then many other disabilities. So while I specialize in treating autism, I also see patients with other special needs as well. And I'll also be telling you about a wonderful gala coming up on October 6th. This is to raise funds to help special needs families and to get the help that our healthcare, education, and social services often don't provide. So before we begin, I wanted to let you know that if you have health concerns and you'd like to talk with me about, we do offer a no-charge phone consultation. The 15-minute phone consultation is where you can talk with me about a condition that you have in order to determine whether I'm the right doctor to help you. Arranging a phone consultation is very easy. Just call our office at our new number. We have a new number now that it's updated on our Facebook page. It's 808-425-2987. Again, 808-425-2987. And let our staff know that you're interested in a no-charge phone consultation. Okay, so let's get started. And please feel free to use the comment section to ask questions as the talk progresses. So first of all, I just like to talk a little bit about what each of the, some of the main types of special needs look like and what some of the challenges may be that they face. So for example, in autism, some of the main concerns that we have are primarily with social skills and so being able to relate socially. There's also challenges with communication and language. So that can vary anywhere from some children being completely nonverbal, and there are some other children that are very high functioning that can carry on a conversation, that are able to hold jobs and all of those things, but may have some difficulty with just being able to relate socially, carrying on conversation. Also, there can be difficulty with certain stereotyped or repetitive behaviors, a need for sameness, difficulty with transitions. So those are some of the main challenges that we face with autism. Another one that I commonly work with is Down syndrome. So in Down syndrome, there is an extra chromosome, and that leads to abnormalities, sometimes in cognitive functioning and processing, but there's a wide spectrum of functioning in terms of cognitive function in Down syndrome. So there are some individuals with Down syndrome who have significant challenges with cognitive function, and there are other individuals with Down syndrome who are very high functioning, who again are able to hold jobs, who are able to go to college, and be able to do a lot of different things. So there's a pretty wide range in terms of functioning. In Down syndrome, there also do tend to be many different challenges with many different physical conditions. So there are, for example, issues with a tendency for heart defects or heart disease. There can also be a tendency to cancer, certain types of musculoskeletal abnormalities and issues. So there are some of those types of things. Another common one that I work with is sensory processing disorders. So in that, the way that the brain processes sensory input, so basically input from what you see, hear, feel, smell, the brain's ability to process the type of sensory input is abnormal. And so what happens in those cases is that even though there's no abnormalities directly itself in terms of sight or sound or the body's ability to be able to sense touch, there can be abnormalities in the way the brain processes that information. And so in those cases, then we have individuals where oftentimes certain types of sounds may be really upsetting to them. I see individuals where if like the sound of a vacuum cleaner, for example, might set them, into a meltdown where they're screaming and crying, and it's something that can be very, very difficult for them. Certain types of sounds, again, sometimes it's loud sounds, sometimes it's not, but certain sounds can be very, very upsetting. Flashing lights or other types of lights can be very bothersome to them. It could actually, some people even describe it as painful. Some people are overly sensitive to certain smells. And oftentimes in sensory processing disorders, there are abnormalities with the body's interpretation of touch. And so, for example, when there's touch on the skin, then we often see issues with certain people being very resistant to touch, especially on, like, say, their hands. They don't like their hands to be held, or having their ears touched, or things like that. There's many, many other special needs, and it's more than I have time to really cover in our talk today. But those are just some of the ones that I see most commonly. There's a number of others, and I do want to recognize that there are a lot of different special needs, physical, mental, emotional. But those are just some of the conditions that I see most commonly. And what do families have to deal with? What are their challenges? So there's a lot of different things, a lot of different challenges that families have to work with. And so that's one of the things that we'll be talking a little bit. We'll be talking with my mom, and she'll be sharing a little bit of that. And one thing that I do like to share is that, the medical field, of course, is very, very important. Many of our children and adults with special needs have significant physical conditions where you need multiple specialists. A lot of the children that I see they may have a neurologist, a gastroenterologist, a psychiatrist or psychologist, and many different specialists. So, but one thing that I want to mention is that there are many different treatments that are used in naturopathic medicine and holistic medicine that can make a difference. So many of the conditions, for example, with autism, with Down syndrome, cerebral palsy, diet can make a really big difference. And so many, many children, particularly with Down syndrome and autism, I often see issues with their gut. And so diet can make a huge difference. Sometimes there are certain foods that they're sensitive to that can cause issues, and that removing certain foods that are problematic can really help, not only with digestive symptoms like constipation or diarrhea or tummy pain, but also can really make a big difference in terms of behavior as well. Because if you think about, if you have an upset stomach and we're not feeling very well, then we're not going to be in the best mood either. And Also, there are specific types of supplements, vitamins, herbs that can also help with many of the medical challenges that they're facing. Many individuals with special needs also have issues not only with their gut, but with their immune system, also with the brain, obviously with cognitive function, but also there can be issues like brain inflammation. Brain inflammation is not always life-threatening, but there can be issues with brain inflammation that cause issues with cognitive function, and also issues with inflammation in the body in general. And so there's many things that we can do to help to decrease inflammation in the body that can really make a big difference. So that's one thing that is often not known about special needs, that holistic medicine or natural medicine can really help oftentimes when we're looking at the whole picture. So those are just some things that I wanted to share. And just to let you know, when we wrap up, I'll be reminding you about the no charge phone consultation that we have, where you can talk with me personally about any health concerns that you have. So I'm very pleased and happy to be introducing here my mom. So I'm going to just shift the camera so you can see her. So, and then my father is here as well. So, yeah, so just grateful to have you guys both here. And so there are just some questions that I just wanted to ask. And you know, in our time that we have here for the next couple of weeks, on our Facebook page, we're really focusing on special needs, and so wanted to just be able to talk with you guys a little bit about your experience, and also I think just sharing, you know, I think the representation in terms of what families who live with special needs, both the challenges as well as the joys that they experience. So just wanted to share about some of those. So just wanted to ask first, you know, if you could just share with me briefly about, you know, when you first noticed signs of autism, you know, with your son, and then when he was diagnosed.
We noticed something different about him when we brought him home. He was about maybe 4 months old, 5 months old, when we would lay him on the bathroom counter to change his diaper. And at the same time, we'd be kind of trying to interact with him, you know, looking at him and talking and playing with him. But he would always avert his face. So he'd turn one way. And so we'd go on the other side to kind of try to make eye contact. And again, he would avert his face. So we'd go on the other side. And we thought that was just, you know, cute at the time. But our pediatrician, is it right to mention?
Yeah.
Dr. Ann Barbie Yee, who's retired now, but a wonderful pediatrician, observed that he wasn't making babbling sounds or the normal baby sounds you make as you learn to speak, when he was about 2 to 2.5, I think. And so she eventually referred us to the State Department of Health, the Diamond Head Health Clinic, for testing. So they did a very comprehensive testing, physical, psychological, even social. They would come over and then, you know, just observe him playing outside and observing the mother-son interaction. They were never able to diagnose, to come up with a diagnosis. So we just live with that. They, the State Department of Health, did refer us to, I believe it was the DOE.
Department of Education was very, very helpful. They provided intake for medical into their program.
Even though we didn't have a diagnosis yet. So yeah, so they treated what they thought were the things that he needed help with, which was talking. He wasn't talking. Eventually, when he did learn to talk at about age 4 or 5, it was with a very high-pitched voice, and he was very hard to understand. He was a normal boy, except for the certain functions. Fine motor skills were very were not good. Anyway, so they stepped in to kind of treat what they thought he was a little behind. But we did not get a diagnosis. So finally, at the age of 11, we were seeing a Kaiser neurologist who who brought in this autism specialist. And together they put the finger on what it was, which was our son. It was diagnosed with high functioning autism or Asperger's syndrome. We didn't know anything about that at the time.
We really want to thank our PCP with Kaiser. He was the one who actually brought that the diagnosis up to our attention. And he said it might be Asperger's syndrome. And when it was finally diagnosed, it was such a relief for us. Something we could research and read upon and put a name to his condition.
And find out what can be done to help him.
Mm-hmm.
So
Yeah.
they were really good.
Mm-hmm. Yeah. And I know that for me, it was just kind of like, that was my inspiration. I really feel like, Michael was my inspiration to go into the field, because I felt like for so long, I was just, even as a child, was looking for things to be able to help him, now he's come a long way in that time.
Yes.
So I just wanted to kind of touch on, I guess, the experience, of, living with special needs.
Mm-hmm.
And just wanted to ask, what were some of the most difficult things for you as parents about, raising a son with special needs, but also the things that gave you the most joy as well?
We were both worried that he would be ostracized once he started going to school. He was recommended by the state Department of Health or DOE to go to this preschool for children with disabilities. The teacher there, if I may say her name, Mrs. Stephanie Nakamura, was the most wonderful special ed teacher. So she really exposed all the children in her small class with her aide who helped her to a whole lot of different activities and experiences. And I think that really made a big difference. But once he started going to regular school, which was a year later, at age 6, he started kindergarten. We were really worried that the children would, ostracize him or make fun of him or, just not accept him.
For parents, as all of you know, you want to shelter and protect your child as much as possible. And we were worried that he'd be bullied, not taken care of. So that was one of our biggest anxieties. Mm-hmm. For parents, you're going to find different levels of acceptance and support by children, by parents of their children's friends. So all of that was our biggest anxiety. Some of the best times was when Michael did find children who were accepting, loving, protective of him. He had one young man, young Hawaiian man, young man. He says he watched over Michael in high school, and that family was so happy that he had someone watching out for him when we couldn't be there.
Mm-hmm. And eventually, we hadn't thought that far ahead, but we thought that hopefully one day he will be able to be independent and happy and find success in whatever he would like to do in his life. So we're hoping for that.
Yeah.
Still working on that.
Yeah.
But he's come a long way.
Yeah.
So there's hope. There's always hope. And of course, he is high functioning. So there is a big difference. We know that with other cases of autism, it's much, much more difficult. So in that sense, I think we were fortunate. We were blessed too, that he is high functioning, can do much.
Yeah. I know he's come a long way too, because I remember when he was younger, I think like when we're talking about his history, that he didn't start babbling until he was about 3 years old, and he didn't have words until he was about 4 years old. Yeah.
Yeah.
And then, and then, now he's, Michael's able to have conversations and, hold a job. And,
Yeah.
so it's been a journey for
Yeah.
sure.
Yeah.
I just wanted to see if you had any advice you wanted to share for families with young children who have just been diagnosed with special needs. If you have any thoughts or advice now that you have a child who's older with special needs.
First of all, I think that just remember you're not alone. There are so many people with different disabilities out there. It's important for you to seek out, I think, organizations or families or that are in the same boat as you are, because through sharing your experiences, you're going to just be able to have that camaraderie and things that will help you. You're going to learn a lot from your sharing your experiences, and a lot of organizations are out there who can help you and also expose you to a lot of different experiences for your child that I think are really going to help as far as a high functioning Asperger's syndrome person. It'll help them when they go through a lot of different experiences. And for Michael, anyway, we know that he's been through a lot of great experiences as he was growing up, and I think maybe that's why now, as an adult, he doesn't seem to be afraid to just go try new experiences. Let's see, I wrote down some notes. I would also say you're going to have to learn to laugh about a lot of things, because otherwise you'll cry. Do you want to share some experiences so that they were funny, or there's
Yeah,
not
sure.
much time? Back in about third grade, this was Michael was already mainstreamed into elementary school. Fortunately, again, DOE provided an aide who would be with him in school classes. So we were very fortunate that. But in third grade, for example, the teacher told us that Michael would often lock the door to the classroom, and the students would complain about it. So the teacher would say, well, if you know he's going to lock the room and you cannot come in, then you just have to go through the back door. And another time lots of times he would be on the computer, her computer, early in the morning before school started, banging away and doing all kinds of things on there. And again, she adapted to that, even though she didn't know much about autism. She just adapted to where he was at and tried to work around it. But it just made you laugh to hear those things at the end of the school year, that he would be on the computer, and so finally she decided he could be the one to take attendance and decide or find out for the children who wants school lunch, and who doesn't. So all these things, when you look back on it now, especially when we look back on it now, it just makes you laugh. But it's important, I think, to be able to just laugh at some of these experiences, and because we'll have to live with it.
And yeah, I think that's really important. That in terms of some of the focus that we have in this 2-week period that we're focusing on special needs is how just the general public can also things that are helpful for them to know, or how they can help children with or adults with special needs. And I think that's one thing that you brought up in that story, is just trying to understand where they're coming from or their perspective as much as possible, and then being flexible, because I think that can be very, very helpful. We're gonna need to finish up briefly, but I had one more question, just in terms of if you have advice or things that you would like the general public to know about how they can best interact or help people with special needs. There's a lot of course, different functioning levels. So, but just any advice that you have or things that you would like people to know.
Okay. May I just go back to that other question you were talking about? The last thing for that other one is for families with special needs children is to just be grateful also for all the little steps that you're going to be taking or the help that you receive from your therapists, your doctors, your teachers, aides, everybody, because we know that they really work so hard for your child. And just to be able to look at the things that are done and just be grateful, I think it's just it helps to boost your spirit, and you will gain a lot from that. Anyway, going to how families of irregular children can help out. I think it's important for parents to teach their children that there are children who are different. That doesn't mean that they're less than your child, but they're just different. Every child is different, and it's important for the parents to just share the experience that, maybe Jan or John is different in this way, but we need to love him. He's just like you and me. We need to love him and just be kind and also model that behavior. You can, if you have a child around, you can maybe go up and just talk to that child or just be kind. Just model for your own children what it's like to be kind to others, because I think children, they learn most from their parents' behavior.
That's true. And also you kind of discern from outward appearances who is a special needs child or not. And so what my wife had said is, you treat everyone kindly with respect, no matter who they are or what you think they are. Because that's the way we want to all be treated too.
Yeah, and I think too. I mean, like I've had sometimes people say like, oh, I just don't I feel uncomfortable around so and so. I don't know if they understand, or like I don't know how to talk to them. Like, we'll just talk to them like a normal person, and and just talk to them like a normal person. And and then it's, of course, if there's caregivers or other people around, it's helpful to ask them about their child because there are certain children that are extremely sensitive or certain things really bother them. So certain things are really important, so, and every child is different. So if you can talk to parents or a care provider or someone about, how it's best to help interact or things like that. But in general, say, just of course treat them with respect and just talk to them like a normal person. Because what I often find with many, many children and adults with special needs is that very often they understand way more than most people give them credit for, And I have, there are some children that I see in my practice that they might be stimming and looking out the window and making noises and squealing, and it looks like they don't understand, or they don't hear what was said. And then afterwards, parents are like, and then after that happened, they came back, and several hours later they repeated word for word everything that was said in that conversation. Or some children that may look like they don't understand, and then later on the parents said, oh, they got upset because they understood what was being said or what was going on, And so so that's the thing, is that I think most times many people don't give enough credit, I think, for the abilities and the special abilities and the gifts of our special needs children. So I think that's one thing too. We're gonna have to wrap up. Yeah. But, yeah. Do you want to share something really quickly? Or
can I share something? I forgot to add. For the parents of regular, normal children, please talk to your children at their level too, because their understanding, it depends on their age, their understanding, but And they'll probably have a lot of questions about these special needs children. So just listen and then try to communicate to them at their level, what you know about this child or children with special needs. And again, they're going to learn from you a lot, and they're going to model, especially they'll model after you.
Mm-hmm. Yeah, thank you. So, yeah. So I just really want to thank both of you guys for joining us. And I'm just gonna conclude, but thank you so much. So I was just gonna say a few closing remarks. Thank you again for all of you for joining us. So grateful for your being here. And so a few things that I wanted to share. My mother mentioned some organizations. So finding organizations that you can network with that can be supportive. And so I wanted to mention some organizations. So one is, so particularly with autism, here in Hawaii, there's the Hawaii Autism Foundation. There's also TACA, or Talk About Curing Autism. So they're a national support group as well as a local support group. So TACA, Talk About Curing Autism. There's also the Autism Society of Hawaii and Autism Society of America. For Down syndrome, there's the Down Syndrome Ohana of Hawaii, and so they definitely provide resources specifically for Down syndrome. And there's a number of other special needs groups. There's one organization called the Keli'i Foundation, or the Keiki Education Living Independent Institute, and this is an organization, it's a nonprofit organization that provides support and help to special needs of all types. So it's really to help support all types of special needs, both children and adults. And so one thing I wanted to mention is that this organization, it's abbreviated Keli'i Foundation, short for Keiki Education Living Independent Institute. But the Keli'i Foundation is going to be having a fundraising gala coming up, and I just wanted to let people know about it and to help to spread the word. So the gala will have information about it on our Facebook page, but the gala is a casino night theme, and it's going to be a really nice dinner, prime rib dinner, and that's going to be on Saturday, October 6th. And it's going to be from 5 to 9 p.m. at the Ke'ehi Lagoon Johnny Burns Hall. And again, we're going to have information about it on our Facebook page here. And so the Keli'i Foundation, this gala is going to be raising funds for scholarships for families with special needs to help cover therapies that are not covered by insurance. Also for a number of other programs. I'm part of the Keli'i Foundation, and we run a number of educational seminars to help empower and educate parents, to give them resources and tools to know how to help their children. Also, we have socials and a number of other programs that we run throughout the year. And so this gala is going to go to benefit all of that. So all of the proceeds will go to help families with special needs. And so there are ways that you can help. We invite you to attend the gala if you can make it, if you're here in Hawaii. If you're not able to make it, or if you're not on Oahu or off island, or on the mainland or other places, please help to spread the word through Facebook. We're just trying to increase awareness about the gala. So again, it's going to be a really nice prime rib dinner. There's going to be casino style games. It's not going to have gambling, but there will be opportunities to win prizes. And there is a grand prize Las Vegas trip. That's going to be the grand prize. So there's going to be a silent auction as well. And so if you can't attend the gala, other ways to help, we still are in need of volunteers, and we'll be putting up more information about ways that you can help to volunteer. And so we do need volunteers. We still are accepting donations for the silent auction. And so we're accepting silent auction donations, large and small. We have a number of businesses who are donating a lot of really nice things for the silent auction. And we also have, you know, some simple things. So donated services. It could also be something as simple as baked goods. So whatever you can donate to the silent auction, we are still accepting silent auction donations. But the main thing that we need help with is really just helping to get the word out about the gala. So please, you know, help to share our Facebook post about the gala online. Let people know. And again, we're really grateful for your joining in. So thank you for being here. I appreciate the opportunity to let you know about the often misunderstood world of special needs. And if you'd like to arrange a personal no-charge phone consultation, again, it's really easy. Just call our office at 808-425-2987. You'll also find our contact information on our Facebook page. Mahalo, and we'll see you again in 2 weeks. Our next Facebook Live event will be on September 24th. Mahalo and aloha.